Great. Hello, everyone. I'm being spotlighted. I think that's my cue to begin the session today. So, welcome to the third quarterly connections meeting of the Hunger, Nutrition, and Health and Pregnancy Action Network. I'm Rachel Forensic with the CDC Foundation and really happy to have you all to here today and really looking forward to our discussion. We use this as an opportunity to learn about what is happening related to nutrition and health from preconception through early childhood and to help unite organizations doing similar work to leverage their strengths and resources. In December, we learned about or heard more about the developmental origins of health and disease research that this action network is built upon, how nutrition before and during pregnancy and the first years of life impact lifelong chronic disease. Today, I'm excited to have two guests with us today. We're going to learn more about food as medicine programs for pregnant and postpartum women in Georgia. And then we'll break into small group sessions for discussion and connection. So half of our time will be presentation and conversation between our guests, and then the other half will be conversations with everyone. Last time our conversations were really fruitful, so we're hoping that you'll be able to stay for the full hour. Before I turn it over to Liana Haywood, who's going to lead us through the next section, I just want to make sure everyone knows that the Hunger, Nutrition, and Health and Pregnancy Action Network will be presenting at the AMCHIP conference that's coming up this weekend. And anyone who is in the DC area or will be at the conference, if you've probably already been invited, but if you're able to come over to a reception we're having on March 9th from 5 to 7, a networking reception, we welcome you. We'll have some information that'll go in the chat in a little bit later. So with that, I'm going to go ahead and pass it over to you, Liana.
Hi, everybody. Good to see so many faces in the room again today. Thank you for being here. So as Rachel mentioned during our last meeting, we had Kent Thornburg and Marie Francivert, who were talking about the research and provider side a little bit of the science that grounds the work that we develop, that we use all the science that grounds all the work that we do. That's what I'm trying to say. The developmental origins of health and disease. And we wanted to talk this month a little bit about how we take that and turn it and translate it into community-based work, the barriers that exist in getting that work put together, some of the partnerships that have been put together. And we're highlighting a couple folks from Atlanta, who some folks at the CDC Foundation and others have worked with over the years to talk about a specific program that they have there. So I am going to introduce Laura Samnata, who is the Director of Nutrition Services at DOHaD. DOHaD is a nonprofit organization established in 1988, accredited by the National Food as Medicine Coalition, and focused on providing best-in-class meals and evidence-based nutrition education to socially vulnerable populations. DOHaD prepares, packages, and delivers medically tailored meals that are designed and nutritionally balanced by a registered dietitian nutritionist for people of all ages, including homebound individuals at congregate meal sites, and people living with chronic conditions. Today, DOHaD is the largest community-based provider of medically tailored meals and nutrition services in the Southeast. And then we are also going to speak with Lisa Pennington, who is the Director of Population Health at CareSource in Georgia. CareSource is a national nonprofit managed care organization founded in 1989 that provides health insurance to over 2 million members, primarily through Medicaid, Medicare, and health insurance marketplace plans. As a mission-driven organization, it focuses on improving health outcomes for underserved populations, offering coverage in several states, including Georgia, Ohio, Indiana, and more. And they have a pilot project in the Atlanta metro area they're going to talk to us a little bit about that is doing medically tailored meals in a transition for families from hospital to home in the postpartum time period. So like we did last time, I have a couple of questions and we're going to go back and forth. And anybody who has a question for either of these folks or about the topic in general, please stick it in the Q&A and we will have time to ask them directly afterwards. So my first question is for Laura. March is Nutrition Month. Probably everybody here knows that. We're all celebrating it. Open Hand is a founding member of the Food is Medicine Coalition. Can you tell us just a little bit about that coalition and the importance of it in your work?
Sure, yeah. Hi, everyone. Afternoon. Good to see you. So the Food is Medicine Coalition is a national coalition of organizations that look like Open Hand. So they're providing various food is medicine programs like medically tailored meals, medically tailored groceries, and then adding that dietitian component into those interventions, providing medical nutrition therapy. Um, Across the nation, we're serving people living with severe and chronic conditions and really working together to advance those interventions through policy change. We go to DC a lot to do some advocacy work, um, and research and evaluation, and just sharing best practices across the network. And so we created the medically tailored meal intervention and started the accreditation program as well. And right now we're working on the medically tailored grocery accreditation program also. So we're excited to get that rolling. Um, but yeah, medically tailored meals, it lends to serving women and pregnant people because of the way that our goal is to serve people with chronic conditions or severe conditions. And having the dietitian involved really adds that nutrition care piece and makes sure that the meals are appropriate to serve pregnant people. There's lots of organizations in the medically tailored meal space now, but having the Food is Medicine Coalition with a set standard of nutrition, and the dietitians is what really differentiates us into this work. But I also wanted to mention that I am one of the co-leaders of the Food is Medicine Coalition Clinical Committee, and we're the group of our RDNs, the dietitians, from across all these organizations that are part of FIMIC. And we recently added a gestational meal or gestational diabetes nutrition standard into our set of standards. So that's exciting to see the growth that the Food is Medicine Coalition is also seeing in serving pregnant people with different conditions, and having them, be a part of the medically tailored meal intervention and seeing lots of great health improvements.
Great, thanks. We're going to dive into a little bit about the specific pilot program that you guys are working on. So, Lisa, CareSource and Open Hand are partnering with other groups in Georgia to launch a pilot program enrolling postpartum women in a food as medicine program. Why is working with pregnant postpartum women a priority population for CareSource in Georgia?
Well, I think for us, CareSource in Georgia primarily works with the Medicaid population, and I'm sure most of you know our maternal and infant mortality rates in Georgia is very poor. I mean, we're among the lowest across the nation in our rates. So we try to partner with community organizations like Open Hand and others to really address the needs, not only from a medical standpoint, a health and standpoint, but also SDOH, because we find that a lot of our members not only have health issues, but certainly SDOH issues, so food insecurity and things like that. So that's why it's kind of important for us to identify partners like Open Hand and try to put interventions in place to help support our members the best we can.
So how did this connection between Open Hand and CareSource on for this specific project come about?
This specific project was interesting. We actually were outreached by our state Medicaid office, the Department of Community Health, and I believe they had went on a tour to Open Hand, and I don't know if Laura can speak to that a little bit, but we were outreached by them with an interest in meeting to talk about the pilot because they're very interested in the outcome. So, Laura, if you want to speak to that a little bit more, their interest.
Yeah, I mean, I think in the past, in like 2020, CareSource and OpenHand worked together. And so I think just hearing about all the great work that we partnered on another pilot project on. So we've been connected for quite a while. And I think OpenHand's, been interested in expanding our partnerships in the healthcare spaces. And so I think with all the good data we had from our other project, they were really excited and happy to see us connect again. So with this project, our plan is I might be jumping questions, I'm sorry.
No, that's okay. Well, yeah,
Okay.
tell us a little bit about what this project actually looks
Okay,
like.
cool. Okay, so this time we're going to serve women who are postpartum, which has a lot of interest to CareSource that I hope Lisa can say more about. Um, and we have a lot of interest in that as well. That was a moment in time that Open Hands saw was really helpful to get medically tailored meals to women during this time. So we are going to provide 4 weeks of medically tailored meals and then transition them to 4 weeks of what we call market baskets, but that's shelf-stable items that are, like pantry bags with a lot of fresh fruits and vegetables that go along with that. And then the the funding that we have right now is not supporting nutrition education, but we have another opportunity coming our way, and that we're excited to add some more nutrition education into this pilot because the nutrition education is a really great tool to teach and learn new kitchen skills and healthy recipes for mom and baby. So we're excited about that.
Yeah, and I'll add that we're kind of in the well, not in the planning phase. I
Yeah.
guess we're in between planning and implementation, where we're running parallel tracks as far as and when it comes to our Medicaid members, any kind of messaging, communications, materials that goes in front of our members has to be approved by the state. So, Alita McLean has done an outstanding job putting together a survey. So we're going to do pre and post survey questions of the members who enroll in this pilot. Right now, we're looking at up to maybe 50 to 55 members, given the amount of money that we have for this pilot. So we're going to do the survey. That has got to be approved, all of the messaging. Well, at the same time, we're tightening up the memorandum of understanding between not only our agency and Open Hand, but there's also a group that's kind of spearheading this called Voices for Georgia's Children. So they're an advocacy group here in Georgia who actually brought the idea to CareSource and then pulled back in Open Hand when we were further down the line in the planning. So we're getting there. We're almost there in the approvals and the sign-offs. We're really excited to get started. I'd say from our standpoint, we have a very strong care management team. They're called the Mom and Baby Beginnings Team in CareSource. They wrap around our pregnant and postpartum members. They'll work with a member up until delivery and then 84 days post-delivery into the postpartum period. So those will be the members that we're going to target, those that are enrolled in the care management program that have hypertension, diabetes, as well as may have delivered a baby in the NICU. So it's going to be a small pilot, but we're hoping to see some really positive outcomes.
Well, let's talk a little bit more about the outcomes. What exactly are you measuring and what would success look like for this pilot for you?
Yeah, I think I'll let Laura speak to kind of some of the survey questions and what they'll be digging into there. But as far as us for health outcomes, definitely want to make sure that they're attending the postpartum appointments, that the baby is connected with a PCP or a pediatrician. Mom gets connected back with a PCP after seeing her OB. Looking at, ED utilization rates, inpatient rates, all kinds of health metrics like that, just to make sure that mom is staying healthy. And this wraparound support is giving her the best outcome or chance for that.
Yeah, and from the open hand side, we're gonna at intake, once we receive the referral, we're gonna ask things about food insecurity. We'll do a nutrition risk screening as well. I think we're gonna ask the CDC Healthy Days survey as well, and checking quality of life. And just other questions around postpartum and if these meals and the nutrition education help to reduce stress. I know this is a very vulnerable time for a woman. And we'll have satisfaction questions as well. So just making sure they're satisfied with the meals. And I guess this is post-survey questions, would be the satisfaction if the meals help them follow the nutrition guidance that their care team is asking them to follow. Um, Similar to what Lisa said, seeing if they're making sure they're connected to providers, they have good medication adherence, and if it's been helpful, having more healthy food available to them.
Yeah, and I'll add one other component of this pilot, which is originally when Voices came to us to discuss this idea, it was based on some research they had done out of Tennessee and Delaware of a diaper pilot that they had. Actually, it's turned into Medicaid benefits now, where Medicaid members can have diapers paid for in those states. The two states are a little bit different, but the idea is the same. And so that was part of the discussion when we originally met and started talking about a potential pilot. So what we're going to do in addition to the open hand meal delivery and food baskets is we're looking at the 2 month period, and members will be given two $75 Amazon vouchers. So one per month, as long as they remain in this pilot. And what's been great about this is actually kind of a benefit we already offer to our members who are in care management or pregnant members, and they have delivered and attended their appointments. But we have an Amazon business account where we were able to actually build our own mom and baby platform. So we can load it with whatever kind of items are available in the Amazon storefront, and just kind of load it into this platform. And then members will get a link with their voucher code that they can go specifically to the storefront that we built out to add items that they may need. So it ranges from feminine products to, bottles and pack and plays, whatever might be available. And it's been a very positive benefit for us to the point where we get feedback from the care managers to say, hey, I've got a mom, she's asking whether or not this could be available in the platform. And it's a pretty easy add. So we're able to customize it as well. So it's been a great benefit. And I think for this pilot, right now, our members only get one voucher. This pilot will involve two, so I think that will further address some of those SDOH needs as well.
So do you have something to add, Laura?
Yeah, just sorry. I wanted to add one more thing I thought of. And with the short duration of this pilot, I think we felt it'd be harder to measure health outcomes. And so we're not measuring a lot of that, but trying to, like Lisa said, have all those wraparound services with meals and nutrition education and all the care management that we'll see some good short-term changes that we're excited about.
Yeah, and it's been a great planning team because we've kind of tossed it back and forth. Originally it was just going to be food boxes, and then somebody said, well, let's test it. Let's see what it would look like if we did the prepared meals. So that's why we're kind of splitting it up and getting that feedback to see what members are going to prefer. For us, we would, if this is successful and well received, it's something that we would love to offer as a permanent, value-added benefit as part of our plan.
Awesome.
So you guys addressed this a little bit, but we're looking at like the longer term benefits for programs like this. Last month we were talking about the science and understanding more about how nutrition in that first 1,000 days during pregnancy and the first couple of years of life really impacts long-term chronic disease risk for the offspring as well as the mother. And so this is just a pilot. And I understand that you're not looking at longer term health benefits, but what do you see as some like longer term benefits that might come out of projects like this, or if this could become a permanent benefit? What are the longer term community health benefits?
Do you want me to go first, Lisa? Okay. Oh, you're muted just in case when you try and just talk again. Okay, so um, one of the long-term goals for Open Hand, I think, is just creating that long-term pathway of getting referrals to meals so that, folks can access healthy foods during pregnancy and postpartum. Those are some definitely pivotal times in a woman's life. I wish I had this assistance. It would have been really, really helpful for me even. So just, just increasing the accessibility of healthy food, especially for its fresh fruits and vegetables, are really important to us. And we just want to see and improve health outcomes for mom and baby during this time.
Diane, can you? Oh, okay,
There we go.
she's on mute. There you
Sorry
go.
about that. Now I forgot the question. I'm so sorry.
What do you see as like longer term community benefits to programs like this?
I think first off, this has been great collaboration, and I think the more we can have programs like this and more community agencies and organizations involved to really extend that reach, I think will be beneficial. Like Laura said, I mean, this is a short-term pilot. Um, what we offer as far as benefits are within that little short window of postpartum. So it's just the consistency, I guess, and stressing the need for how beneficial care management support is. And we're always trying to increase those members that are enrolled in care management. So the more that we're able to do that, I guess, by offering benefits like this, I think that will strengthen the positive outcomes.
So we're going to move into some Q&A, but I just have one question I wanted to kind of kick us off with. Lisa, could you address what would the process be like for having this turn into a permanent benefit for your members?
Well, every year we have to submit items that we want to add to our comp chart is called. So they're in Georgia. Each of the CMOs has to make kind of a list or a chart of the items that they offer as value-added benefits or rewards for their members, and then it has to be approved by the state. So I think we're kind of ahead of the game because the state is very interested in this. I think when we met with them, they weren't so much interested in, if this is a successful pilot, then we're going to make Medicaid, pay for it all. That's not the goal. I think they really wanted this to be a test, so that if it is successful, this could be proof of concept for the other CMOs to possibly raise, or put something similar in place. So yeah, that's kind of what we're looking at. Yeah.
All right. Well, thank you guys. This has been a really informative learning about this pilot project. And just so other people know, I know that you were talking about a former project you did that was for pregnant women, right? A medically tailored meals for pregnant women. And this is the
Right.
next one, which is the postpartum time
Those that
period.
were diagnosed with gestational diabetes
Mhm.
specifically. Yep. So they took a
Okay.
2-hour nutrition class and then they received 16 weeks of medically tailored meals, like dinners and lunches, and then a $50 gift card for breakfast items and snacks to try and cover all the meals during that time. But it was right after diagnosis, and then so that got a little bit 1 to 2 months into the postpartum period as well. And we shipped those meals across Georgia. It wasn't just Atlanta, that was shipped across
Oh,
Georgia.
wow.
Yeah.
So anybody who has some questions for Laura or Lisa about this program, drop those in the Q&A and or raise your hand and you can come off mute and ask them yourselves if you prefer that as well. Maybe you just did such a great job of explaining that people have no questions.
Yeah, Liana, can I ask a question if no one's
Of
in the
course.
queue yet? Thank you, Laura and Lisa. This is a really exciting program. I know that the Georgia General Assembly is meeting right now. It's the legislative season, and I'm wondering if you'd feel comfortable saying, if you were to be able to be in front of them, is there one thing that you'd want them to know or do that would help make medically tailored meals or food as medicine even more accessible for the Medicaid population? Did that make sense?
I
We
think
won't hold
so.
you. We won't hold you to it. But
Uh, hmm.
I mean, go ahead, Lisa.
Well, I was going to say there is quite a focus on maternal mortality in Georgia. Like I said, I mean, the rates are so high, and I think I would stress the importance of not, again, not just the health, right? The health side of things, but also the SDOH, so the food insecurities. I mean, our members have so many needs not that potentially are impacting the health, right? I mean, if they don't have transportation to be able to get to the doctor, or they don't have childcare, so they're not going to go to the doctor because they have to, stay home or can't bring the kids. So it's everything connects. So that's what I would say is take a look at the big picture. Food insecurity is a real thing, and I think we need to address more than just a primary focus on health, although that's very important. I think everything is interconnected and really needs to be seen in the big picture.
I think for open hand too, I mean, I think it just makes sense. Like just provide meals for people and especially when they need it. Like it just takes that stress off of them and improves health outcomes. We've seen that in so many pilot projects across the Food is Medicine Coalition that it helps and it improves lives. So just do it.
I love that. Just do it. Nike right there.
Yeah.
So we have one question here in the Q&A. Do you find the need to provide recipes for the food you send, and about how many are going to be served in this pilot?
Yeah, I'm so sorry. I forgot to mention that part. But yes, with the meals and groceries, there will be recipes sent along in their boxes. And for the pantry food, it'll be recipes that follow the items that are in the bag, if that makes sense. So that it'll be, a kind of an outline for them to follow with the food that they get in that bag. And then and there'll be a little nutrition component into those handouts as well.
Okay. I have another question in the chat for Laura. Are the accreditation standards you referenced available on the Open Hand website?
Yeah, they're on not on Open Hand actually, but on the Food is Medicine Coalition. That's the national standard that all accredited Food is Medicine Coalition members have to follow. So I would go to the FIMIC website and then the accreditation tab. I think Caitlin put it in the chat as well. I saw. That is an old version. We're actually about to upload a newer version that'll have that GDM standard in there as well. So yeah, be on the lookout.
Another question here from Natalie. Does this program include making sure the participants are enrolled in WIC and SNAP? And how do you transition moms off the program to ensure continued healthy eating?
Yes, the care managers are making sure that those resources are in place, and if they're not, they assist in making those referrals. Yeah. I think there was a second part to that question.
Is there any transition plan for helping families continue to eat healthy food?
Laura, you can take that
Well,
one.
I think from the open hands standpoint, we'll assess them to see if they qualify for any other open hand meal programs. Um, but yeah, that's definitely something we want to follow them with as well.
And kind of leading up that, I can't remember if one of you mentioned, but is the program for the whole family, or are we just providing meals for the mom?
I think it's, yeah, for mom primarily,
Mhm.
but that is a question on the survey, I believe,
Mhm.
to see whether or not, especially with the food boxes, if it'll be utilized with the rest of the family. Yeah.
That's right.
And do you know if you're looking specifically at moms of first babies, or are we looking at moms who've had previous pregnancies?
Either. Yeah,
Okay.
both. Yeah.
I see one more question here. It says for Lisa, we know of similar projects in other states that are being supported by CareSource. Is there any opportunity for state-based CareSource offices to share information and advocate for broader inclusion of FIM programs across all CareSource regions?
That's a good question. I mentioned that we have a pretty strong care management team, and they actually support all of the markets. So there's different teams across all of our CareSource markets, and yes, they have experience with several markets. I think it may be Michigan and one other that has a meal program as well. So they are very in support of extending this across all of CareSource for sure.
All right, looks like we have two more quick questions, and then we will move on to breakout rooms. So Krista asks, have you been able to capture data or long-term effects that the clients continue to prepare, cook healthy meals? And what does the end of the project look like? We've addressed a little bit about that.
Yep. You want to take the healthy
We
meals one? Yeah.
we haven't. That's something we should do, though. I would love to check in with them 6 months later, after they're in the program and see if anything's changed or if they've kept it up.
Yeah, and for us in Georgia, the Medicaid supports pregnant women in their postpartum period for 12 months. So we're really
Okay.
fortunate that they extended that. But our care management team will only support them for about, like I mentioned, till day 84 or so. But if they feel like there's additional needs, then they'll transition them to another care management team for that added support. So if there are needs, then definitely they're not alone and they'll get that added support continued.
So,
Our last question, how will this data be shared?
Yep. Voices for Georgia's Children actually are collaborating with a consultant. So she is going to be pulling all of the survey data together. We're going to try to pull what we can from our end, and she's going to package it all up and hopefully help us tell a nice story. So, yeah.
Great.
Mhm.
Well, thank you both so much for being here. We're going to transition over to Diane. She's going to put us into our small group. And then I know that we'll be coming back to the room. So if there are any additional questions, go ahead and drop those into the chat and we can see if we can get those answered later. Thanks.
Okay.
great.
Great.
Thank you.
All right, so in just a minute, we are going to randomly assign everyone to breakout rooms. For our moderators, I want to let you know we are going to have 3 breakout rooms. So breakout room moderators are Mandy, Crystal, and Anna. If 2 of you are in one room, I will move you. Just sit tight for a second. And with that, I am going to whisk us into our breakout rooms. Hi, everyone. Welcome back. I hope you had some great conversations together. Technically, the breakout rooms close in 24 seconds, so we're just waiting for the whole group to migrate back to the main room. All right, welcome back, everyone. So I am going to call on each of our breakout room hosts to share some highlights of the great conversations that you had, and I will start with Mandy.
Thanks, Diane. We had a great conversation. I'm calling it the Bloom Room, although I didn't announce that in the group. I think one of the things that we talked about was just about the importance of partnerships and relationships, and just also hearing about programs that are working across our nation, that then inspires people in different areas. And looking at my notes, so we shared a bunch of exciting work that's been happening in Ohio, and we kind of bounced around some ideas, making sure that folks are thinking about similar things. And also, we were talking about the Action Network and what we all can do to, like, joining the LinkedIn group to stay connected, so we're not reinventing the wheels. And yeah, I'm not sure if I got everything, but
It sounds like you had a really good conversation with everyone. Thank you.
yeah, it was very fun to connect.
Awesome. Let's go to our second moderator on our list, and that is Crystal. Thanks so much, Mandy.
Okay. Hi, everyone. Can you hear me?
Yes, we can hear you.
Okay. All right. Apologies. I was still having some audio issues, but we had a great conversation in our group. We had some folks saying that they were glad to see that at the end of the pilot, it's going to, be an example for other health plans to offer this kind of program. And it was just refreshing to see the strong pathway to supporting pregnant and postpartum women. The connection, a connection that was highlighted that should be highlighted is connecting with either health plans or hospital systems so you can collect outcome data. I thought that was an awesome point. So you're going to have to show cost savings of the intervention, and we need data to show improved health outcomes for mom and baby and decreased hospital stays. So I thought that was great. Also talked about partners such as wraparound service organizations that can help link with childcare and transportation. Also, great partners, the state health department, best place to start with because they're convener of other state agencies that touch a lot of social determinants of health. And also talking about how the Hunger, Nutrition, and Health and Pregnancy Action Network can best support. So basically networking was brought up, having the capacity to network and possibly a list of who's doing what. So thought it was a great conversation. Thank you so much.
Fantastic. Thank you for moderating, Crystal. I don't know how you had time to cover all of that in your brief session, but we really appreciate that. And last but not least, I'm going to turn it over to Anna.
Thanks, Diane. Hi, everyone. I was with a lovely group of folks. A couple of things that stood out for the group in terms of the pilot that was shared was this shift from thinking about short-term support to continuous support in the conversation around how to support folks after they finish with the pilot. There's also excitement about engaging with the folks that are participating in the pilot to get feedback in terms of did it meet their needs? Were they satisfied with the food? There was also an interesting discussion around the types of partners to bring in and thinking about the food industry itself as a partner for various reasons. But we were talking about how many foods and meals and such are labeled now for various different needs, whether it's gluten-free or vegan or whatever it might be, and how it would be interesting to think about what it means to label a meal or a food as good for supporting pregnancy or good for supporting postpartum. So I thought that was an interesting and creative idea that was brought up. And then we rounded out the discussion thinking about how a lot of times medicine is positioned as thinking about being supportive of chronic disease and treating chronic disease, and how we can think about positioning food as medicine as a preventative strategy or approach. So lots of good stuff came up in our group too.
That's fantastic. Thank you so much for taking notes and facilitating the group. I want to thank all of our facilitators. And I'm going to turn things over to Liana to wrap things up.
Hello again. I just want to, again, extend thanks to Lisa and Laura for joining us today and sharing information about their program. That was great for us to really be able to hear real-world success stories of how people are taking the science and implementing it into programs that are actually going to improve everyday community health. It sounds like we had some great discussions. I know one of the points I heard a couple times was about these partnerships between community-based organizations and healthcare and food systems and big food, and how we might continue that kind of work. So I love those ideas that are coming out, and the need for more data. Everybody needs their data to be able to justify or look at this as long-term solutions for reducing healthcare costs and improving community health. So thank you for everybody who was part of those discussions. A couple reminders that AmChip next week, if you are going to be there, our workshop is on Sunday, Grounded in Science, powered by partnership lessons from the Hunger, Nutrition, and Health and Pregnancy Action Network. So several of us who are on this call today and several others will be there presenting on some of the work that we've done over the past 18 months, since we would love to see you if you're there. If you're not at AmChip, but you are in the DC area and want to join us, again, we have a reception on Monday evening from 5 to 7. And I think Diane will put the registration link in the chat if that's something that you are interested in doing. We would love to see you. And this is really just a hey, let's get to know each other. Let's have a drink, have a snack, and talk a little bit more to build up those personal partnerships and relationships that we know is a huge part of doing this work. And lastly, I think, we do have a LinkedIn group. We are trying to get it to be a little bit more active. We would love to have you join these meetings. The quarterly Connect meetings happen quarterly, as you might guess. We would love to see you at more of those as we go forward. We're looking at speakers already for the June one, and I think we may have another community-based organization from the Cleveland area called the Cutting Board Academy, I think, if I'm remembering correctly. But if you have ideas for speakers, or if you yourself would like to be a speaker, you have an organization, a project, a plan that you're working on that you would love to share with this group, please reach out and let us know. And we would love to get to know you more in the work that you're doing. And with that, thank you and have a lovely afternoon.
Thanks, everyone. Goodbye.
Bye.